my name is Carolyn. I'm a nurse practitioner student, and I'll be doing your assessment today. Can I ask what brings you in?
Yes, just my annual checkup.
Great. And are you experiencing any pain today?
I'm not.
Good. So at this point, I would take the patient's vital signs, height, measurement, and then I would start with my general assessment. So surveying the patient appears to be calm, in no distress, and well groomed. And now I will also, throughout the assessment, check for skin lesions throughout. So checking for nevi, and based on the ABCDE criteria for severity, and then consultations to dermatology. All right, starting with a neuro assessment. Can you tell me your full name?
Yes, Evan Tyler.
And can you tell me the date?
It is 8/10/2025.
Perfect. And then where are we right now?
We're in my bedroom.
Good. Patient is ANO times 3, no dysarthria, slurred speech, aphasia, clear speech. So starting with the head, I will assess. Just looking at it, appears symmetrical. The skin appears even and pink. So just palpating for any masses, edema, tenderness. Any tenderness here?
No.
All negative at this time. Hair distribution is even. Okay. And then I'll move down to the face. So assessing cranial nerve number 7. Can you lift your eyebrows up? Can you close your eyes tight? Puff your cheeks out. Good. And then smile. Good. Cranial nerve number 7 is intact. Facial features look symmetrical. And I'm going to assess the sensation of your face. So if you will just close your eyes and just tell me if it is dull or sharp.
Dull. 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 Dull.
Did that feel the same on each side?
It did.
Great. Equal on each side, and then
Sharp. 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 Sharp.
great. Did that feel the same on each side?
It did.
Awesome. Okay, so equal sensation on both sides. Cranial nerve number 5 is intact. I'm going to start with palpitation of your sinuses. So the frontal sinuses, any tenderness there?
No.
Good. And as I'm here at your TMJ joint, can you go ahead and open and close your mouth? No clicking, any pain with that?
No.
Good. Now just assessing your maxillary sinuses for any pressure, any tenderness.
No.
Great. Okay, I'm going to move on to my assessment of your nose. So at this time, we would test cranial nerve number 1 and do an orange smell test, where you would smell an orange just to test to make sure that your smell is present. But for the purpose of this exam, I'm looking externally. There's no lumps, lesions. The nose is symmetrical. And now I will look inside each nostril. Just a little bit of pressure inside. So looking at the mucosal, color cherry pink, scant drainage, no obstructions, turbinates, able to be visualized. All right, and gonna look into the other side. Good. Cherry pink in color, slightly moist with moderate drainage, and turbinates visualized. Great. Okay. And I forgot to say this, but I would begin the exam with washing my hands. So just recognizing that now. Okay. All right, moving on to the assessment of your eyes. So just looking externally at your eyes, eyelids present with no lesions, no masses, they are symmetrical, and eyelashes, even distribution of your hair. So I'll have you close your eyes nice and tight. Good. And now I'm going to assess. So open your eyes. The sclera is clear, white, no hemorrhages, no lesions. And I'm going to look down. Good. Conjunctiva is pink. Look up, down, and to the side. No masses, no hemorrhage, no lesions. Great. Okay, now I'm going to test cranial nerve number 3, 4, and 6 with the cardinal gaze. So just follow my finger with your eyes. Great. Cranial nerves 3, 4, and 6 are intact. So now I will move forward with my ophthalmoscope and test your pupils. All right. Normally this would be done in a dark room, but for the purpose of this exam, I will keep the lights on. So just look straight ahead at my nose. Good. Equal reactive 4 in diameter. and equal reactive in 4. Great. Now I'm going to look a little more in depth for the red light reflex. Looking at the macula and the optic disc, so the lights would go out at this time. Okay, just look straight at me. Red light reflex present, look straight at me. Optic disc visualized, orange to yellow color, macula visualized, cup to disc ratio 1 to 3. Great. And looking at the right eye, red light reflex, macula visualized, optic disc yellow to orange, look straight at the light. Great. And optic disc ratio 1 to 3. Great. And lastly, to complete our eye exam, I'll have you cover one eye, and I'm going to have you, I'm testing your visual acuity, so go ahead and cover your right eye, and I would be 14 inches away from you. Go ahead and read the lowest line that you can.
LTFPH.
Great. And then again.
LTFPH.
Good. Vision is 20/20 on both eyes. Cranial nerve number 2 is intact. Now I'm going to take a peek at your ears, starting with an external examination. So ear looks appropriate in size, no swelling, no erythema, any tenderness when I touch the pinna,
No.
the tragus, with the tragus.
No.
Okay, now I'm going to place this otoscope into your ear and look for obstruction. Okay. So tympanic membrane visualized, no obstruction, pearly gray in color, some mild earwax, and then cone of light reflex at 5 o'clock. Great. Bony prominence is visualized. Again, looking at the right ear. Pinna, no swelling. Tragus, no tenderness at all when I press down. No erythema, no lesions present. Checking again for nevi all over the skin. And looking inside the ear, just a little bit of pressure. Tympanic membrane visualized. Great. Bony prominence is visualized. And pearly gray in color, cone of light at 5 o'clock. And yes, scant drainage just from the earwax. Now I am going to test your hearing with the whisper test, testing cranial nerve number 8. So place a hand over your left ear and repeat this number if you can hear it.
22.
Great. We'll do the other side.
44.
Great. Cranial nerve number 8 is intact. Awesome. Okay, so now I'm going to move to the assessment of your mouth. So just looking again externally, looking at the lips, not cyanotic, pink in color, no lesions around the lip lining. Again, even distribution of hair. So now I'm just going to visualize your mouth. Go ahead and open up. Good. Buccal mucosa is pink, tongue is pink, and midline cranial nerve number 12 intact when you say ah. Good. All right, all teeth are present, no dental caries, and then again, stick out your tongue as far as you can. Uvula is midline, tonsils without exudate at a grade 1. Okay, and I'll have you lift your tongue up, to the side, up, and down. Great. Now I am going to test your gag reflex. So go ahead and stick your tongue out as far as you can. Say ah. All right. Cranial nerve number 9 and 10 are intact at this time. Okay. So now I will be moving on to my assessment of the neck. And again, my hands are washed at the beginning of this assessment. So just looking at the neck, trachea is midline, no deviation present. Before I palpate, I want to make sure there's no bruise in the carotid arteries. So I'll have you go and take a deep breath, and I'm going to auscultate the carotid arteries. Hold it hold it. Great. And no burways present. So go ahead and just palpate. Good. Trachea is midline. I would have the patient stand up, but because he's taller than me, I will come behind the neck. And again, just feeling the neck and starting palpitation of the thyroid. So if you go ahead and turn your head to the left and palpating the thyroid, no goiter, no nodules present, any tenderness?
No.
Good. And now move all the way to the other side. Stabilizing with the right hand, palpating with the left. No goiters, no nodules present. Great. And now I'm going to feel for your lymph nodes. First, I'll feel for your mastoid back here. Any tenderness?
No.
Good. So occipital lymph nodes. Any tenderness?
No.
Good.
Murphy, out. Go, buddy. Out.
Post-auricular. Any tenderness?
No.
No swelling. Pre-auricular. Any tenderness?
No.
Submandibular. Any tenderness?
No.
Submental. No tenderness. No swelling felt. And then we have pre-cervical or anterior cervical, posterior cervical, and clavicular not able to be palpated. Great. So I will move on with my assessment of the anterior thorax. First, again, just visualizing for any nevi, none present at this time. Skin looks to be even in color, and palpating warm to touch, pink. And again, just feeling for symmetry here. And feel symmetrical. And go ahead and say 99.
99.
Keep going.
99. 99.
Great.
99.
Great.
99.
Awesome. All right, no tactile formitis. Palpated, felt. All right, now I'm going to auscultate your lungs. So have you go and take deep breaths. For the purpose of timing of this exam, I would assess 8 points on each lung field, and I will just do the right side for the purpose of this exam. So go ahead and take deep breaths in and out through your mouth. And then we go ahead and do 8 on this side. Right side, no adventitious breath sounds, clear lungs sounds throughout. Also just going to assess for any stridor. No stridor present. Good. Okay. Now I'm going to assess your heart sounds. So starting with the aortic heart sound, you can just go ahead and breathe normal at this time. All right, aortic, using the diaphragm. And pulmonic, I will use the diaphragm and the bell. Good. And then we will move down to Erb's point. Just the diaphragm. And tricuspid, diaphragm and the bell. Good. And then mitral valve, diaphragm. Good. S1, S2, no murmurs, no clicks heard throughout any of the fields. Now I'm going to palpate for the PMI. So feeling for that pulse before I auscultate. Perfect. Good. Again, S1, S2. Now I'm going to move to your anterior thorax. All right. Just visualizing symmetry in the shoulders. No nevi present here. And then I'll just have you lean forward just a little bit. And palpating for symmetry. Feels symmetric throughout. Skin is warm. No erythema, no edema. So go ahead and say 99.
99. 99, 99, 99, 99.
Good. All right, now I'm going to auscultate your lung sounds on your back, posterior lung sounds. Again, 8 points in each lung. So I will start and just do one side, and for the purpose of timing, it's 8 on the other side. Go ahead and take deep breaths. In through your nose, in through your mouth, out through your mouth. Good. Great. And then I would do 8 on the other side. Okay. All right. You can sit up. And then just the last cranial nerve, just go ahead and lift your shoulders up. Awesome. Cranial nerve 11 is intact. Now I'm going to have you make your way to the bed for the abdominal assessment. Have you used the restroom?
I have.
Okay, great. So we will sit the patient at a 30 to 45 degree angle. We'll act like there isn't pillows here for the purpose of this exam. Okay, and testing for JVD at this time. So, having you turn your neck to the left, finding the highest pulsation, good, and then comparing it to the costosternal angle. And it is 2 centimeters, so less than 3, which is within normal limits, no JVD present. And then moving to the other side. Less than 3, no JVD present. Great. Okay, so now I'm going to move on to my abdominal exam, starting with just visualization. So no contour, no pulsations, no hernias present, symmetrical features. Again, minor nevi, doing my ABCDE assessment, no ascites that appears. So starting with auscultation of the aorta and the renal artery. All right, just a little cool here. Assessing for bruits, no bruits present on the aorta, and no bruits present on the renal. So now I'm going to continue with my auscultation of the abdomen, starting in the left lower quadrant and placing it on 2 different points to assess for normal active bowel sounds. Good. Normal active bowel sounds throughout. Now I'm going to find some percussion, just assessing for tympani. 2 points in each quadrant. Great. Dual percussion over the liver. And now I'm going to move into some light palpitation, just feeling for any ascites, abdominal organs, any tenderness anywhere.
No.
Doing my special abdominal assessment, rebound tenderness at McBurney's point, assessing for any acute appendicitis, suppressing down. Any tenderness?
No.
Great. So feeling for the edge of the liver here, using my left hand to stabilize at the bottom of the rib cage, feeling for the liver, which is 1 centimeter below the costovertebral angle, and then 7 centimeters in span, which is normal. And then just palpating for the spleen, which I cannot feel, no splenomegaly present. And then again, moving down towards the kidneys, which cannot always be palpated. Good. Good. Okay. And not able to palpate at this time. We will assess CVA when the patient sits up again. Great. All right. So, moving on, I will have you come and sit up. Great. Abdominal assessment complete at this time. All right, so just assessing CVA tenderness. So placing my hand where the kidney would be, just a little bit of pressure. Any tenderness?
No.
Any tenderness?
No.
Great. Okay. And then again, with the lung assessment, just percussing, assessing for any hyper resonance on the posterior thorax. No tympani, normal assessment. Okay, so now I'm going to move into my musculoskeletal assessment, assessing your strength and range of motion in your joints. So go ahead and roll your shoulders back, and then I'll have you lift your arms out. Great, bring them down, come back out, in, adduction, abduction, go up, come down, and then squeeze in, internal rotation. Bring your elbows bent, squeezing towards your back. Good. And then give yourself a nice tight hug. Great. And then we'll move on to elbow flexion. So go ahead and flex, extend, open, close, down, and then cross your hands. And then open, and then cross again. Great. Full range of motion. Any pain with any of those movements?
No.
Any clicking?
No.
Great. And then wrists, I'll have you flex, go down, come in, go out, spread your fingers wide. Any pain there?
No.
And just assessing for carpal tunnel here, I'll have you turn out. Any tingling here?
Mm-mm.
So no tingling by tapping on the tibial nerve. So carpal tunnel would be unlikely in this moment. So now for the upper extremities, again, no edema, symmetrical, no erythema, no nevi present. We'll be assessing pulses, neurovascular assessment. So assessing brachial pulse, good, equal, +2, radial pulse, good, equal, +2. Gazing at the hands, checking for appropriate coloration. Cap refill is less than 3 seconds. No clubbing, no joint deformities here. So now I'll be assessing your reflexes. So I'm going to go ahead and do your brachial first. Just try and relax your arms. Good. Good. Now we'll do your tricep. Good. And brachioradial. Good. Brachial. Good. Tricep. Good. Brachioradial. Good. All right. Now have you close your eyes. I'm going to test sensation in your upper extremities. So just tell me if it's light or dull.
Dull. Dull. Dull. Dull.
Does it feel the same on both sides?
Does.
Great. Again, tell me if it's sharp or dull.
Sharp. 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 Sharp.
Great. Any numbness or tingling? Any sensations beyond what I just asked for?
Nope.
No. Okay. All right. So we will be moving on to the assessment of the lower body. Actually, before we do that, I'm just going to test your strength in your upper extremities. So lift up. Good. Press down. Good. Push out. Good. Pull in. Good. Now I'll have you just your palms press against mine and then press down. Good. Equal +4 strength in the upper extremities. All right. So now we're going to go ahead and look at the lower extremities. I will start by just assessing strength. So kick against my hands. Good. Pull against. Good. And then extend both knees out. Good. Any clicking here?
No.
Good. Come back down. All right. And then with your feet, press up against my hands, toes towards your face, and then press down like a car pedal. Great. Pronator and supine. Good. So now I will go ahead and assess your range of your pulses. So is it okay if I palpate for your femoral pulses?
Yes.
Okay. Good. +2 equal. Popliteal pulses. You can relax your knees. +2 equal. Posterior tibialis. Good. +2 and equal. And then dorsal patellis +2 equal. While I'm here, I'm looking at the skin. I'm looking for nevi. Appears to be even in skin, even hair distribution, no nevi present, no edema, no tenderness in the back of your calves. Great. Checking capillary refill. Good. Less than 3. Toes are warm to touch, pink in color, and then no clubbing is visualized. Great. So now I'm going to move on to my assessment of your reflexes. So far the reflexes have been a +2 in the upper extremities, and we're going to assess if the lower extremities are the same. So go ahead and just relax. Patellar reflex. Good. Good. Now we'll do Achilles. Good. Good. +2 in all lower extremity reflexes. Great. So pulses even, neurovascular assessment done, capillary refill, no nevi present. Now I'm going to have you stand. I'm going to assess your spine. So I'll go ahead by just visualizing the back. Features look symmetrical. Good. Just palpating for edema. Any tenderness here? Any tenderness in your knees?
No.
Good. Your shoulder blades are even. Okay, now I'm going to have you bend from your knees and go ahead and bend over, assessing your spine for any curvatures. Scapulas are symmetrical and even. Good. Any tenderness? And then slowly come up. Again, scapulas are even. Okay. All right. So now I'm going to test coordination and balance. So I'm going to assess your gait. So I'll have you just walk straight. Let me just make sure that this is still going. Good. Okay, I'll just have you walk straight. Great. No swaying. Good coordination and balance. All right, and then I'll have you turn around. Again, I'm going to test your balance. So bring your big toes together. Stand up nice and tall. Go ahead and close your eyes. You would count to 10. Great. No swaying. Good balance. Nice and tall. No drift in either side. All right, and now, again, testing your coordination. I'm going to have you walk heel, toe. Good. 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 No swaying, and then go back. Nice balance. Okay, good coordination throughout. Now I'll have you go ahead and take a seat again. All right, so this will complete our assessment. Do you have any questions for me?
No.
Okay, all right, thank you, and that is it.